Separation Anxiety by Sophia Garza and Priyanka Patel.
Hey Mom, what's going on? What are you up to?
Hi, sweetie. What's going on? Did you need something from me?
Mom, can I go to the mall with my friends?
Oh, sure, honey. I don't have anything going on. I'll go with you.
Oh my God, Mom! I'm not a baby anymore. I don't need you to go with me.
Oh, how I miss when you were attached to my hip. It's hard to believe you had separation anxiety when you were little.
What? What's separation anxiety? Separation anxiety is the fear of being separated from a significant person. 4% of children and 1.6% of adolescents have this disorder, and it's the most prevalent in children under 12 years old. Separation anxiety is typical for ages 18 months to 5 years. Early intervention is key to prevent a lifelong illness. To be diagnosed with separation anxiety, the child would have to present with severe anxiety and last for at least 4 weeks. Causes include severe stress, trauma, genetics, and learned behavior from parents who are noticeably anxious around the child. The more independent the child can become will result in better mental health as an adult. And now on to clinical presentation. The child will present with constant worry about being separated, clinging to the caregiver even when they are home, repeated nightmares with the theme of separation, crying more than a typical child would when separated from the caregiver, panicking or having temper tantrums at times of separation, difficulty making friends, and fears to be alone even if the caregiver is around, just not in sight. Occupations affected. Play, because they only like to play with familiar people. Sleep, because they have trouble relaxing. Social participation. ADLs, because of excessive worry and poor concentration affecting self-care. And education, because of lack of independence causing social isolation and difficulty concentrating.
Now we'll be talking about medical interventions and typical therapies. Typical interventions for separation anxiety include a psych evaluation followed by counseling or talk therapy. CBT is a form of talk therapy that helps identify and develop skills to change negative thoughts or behaviors. Medications used for anxiety are typically antidepressants. Now on to occupational therapy. The first intervention is sensory strategies to calm or slow down the body and thoughts. Relaxation techniques like yoga, meditation, breathing exercises, and Jacobson's progressive relaxation technique. Coping techniques are problem-focused strategies, and the OT provides motivation and support. The steps for coping are as follows: analyze situation, skills training, repetition, mastery of skill, and facing the real-life situation. In this technique, the therapist asks a patient to rank their triggers from high to low and work their way up. Physical exercise boosts confidence and relieves stress. Functional and creative activities not only relieve stress, but they act as a diversion. Now, here's a quick summary on what we learned about separation anxiety. Separation anxiety is a normal part of child development. If by age 4 it persists, intervention is needed. ADLs, play, sleep, and school can be negatively affected. There are several interventions that can help, OT being one of them. And that's the presentation. Thanks for watching.